Good morning, everybody. Welcome to this morning's Grand Rounds and also the first Grand Rounds of this calendar year. We're delighted to welcome Dr. Ram Subramanian as a speaker. But before I introduce the speaker, I would like to provide some housekeeping announcements. If you're an Emory University or Emory Healthcare employee, and if you would like to receive CME credit for attending the meeting today, the login information can be found in the chat feature on the bottom of your screen. And if you have any difficulty with getting the feed from this webinar or logging into the CME, please send Ms. Julie Hawkins an email or drop a note via the chat feature. With that, let me introduce Dr. Ram Subramanian. He is Professor of Medicine and Surgery here at Emory University School of Medicine. He is also the Medical Director of the Liver Transplantation and Director of Liver Critical Care Services at Emory. And in doing so, he leads one of the top-notch liver transplantation programs in the nation. He received his undergrad, medical degree, residency training, and fellowship at the University of Chicago. He did a hepatology fellowship at the University of Nebraska and has been at Emory for a number of years now. His research focus, his clinical and research focus are to improve the outcomes for patients with advanced liver disease, specifically in extracorporeal liver support and hepatic critical care. He is highly published. He has received several national awards, and he's also been a recipient of the Dean's Teaching Award here at the Emory University School of Medicine. Now, if any of you who know him know that he practically lives in the ICU here. And in addition to that, he has found the time to go on and receive an MBA at the Goizueta Business School recently. So we're delighted to have him present on a topic that is of key interest, especially when we're all struggling with the COVID pandemic and trying to make sure that our ability to provide great care to our patients is not affected in any way. So Ram, thank you so much for joining us. I'm going to turn the podium over to you.
Ram, thank you for that kind introduction. It's a pleasure to be here today and have the opportunity to share some thoughts with all of you regarding my MBA experience and how I've been applying those concepts to healthcare delivery and administration. But before I get started, I just wanted to share with you that you'll hear, as we go along the slide deck, you're going to hear about different models, different frameworks within the different disciplines of the MBA. And one thing that really helped me bring those concepts alive was to apply those concepts to my domain of liver transplant and liver intensive care. And so I would, as you come across these concepts during the next hour, I would invite you to think about how those constructs or those frameworks would apply to your specific cancer service lines. So with that preface, let me get started. Sorry, I'm having just a bit of a technical issue here, so let me just try to fix this. For some reason, the slide deck is not advancing. So Ram, what I'm going to do is I'm going to stop sharing and try to get this back online. For some reason, the screen is frozen. Can you still hear me?
Yes, we can hear you.
All right, let me just briefly stop share and come right back in and see if I can start again.
Ram, try using the arrow at the very bottom of the slide, which is the right and left. If you can click on that, it tends to work better.
Yeah, I've tried that as well, actually. For some reason, it's...
Sorry.
Yep. let me see if I can. Let me do the following. Sorry, a bit of a technical hiccup here. Let me just sort of go back out and try to come back in here. For some reason, I don't know what's the issue, but let me try one more thing here.
Okay. Do you want to go to not the PowerPoint, but the slide mode, and then just use your mouse to move around?
Yeah, let me sort of let me just get out just for a moment. Yeah. Actually, let me do the following. Let me just, for the sake of time, let me get out and come right back in. For some reason, it's frozen, so I'll be right back.
Okay. We'll take a brief pause.
Can you see my slide now?
Yes, we can see your slide.
Oh, great. All right, we're good. Sorry about that hiccup. So just from an outline standpoint, number one, I'd like to review the MBA curriculum and talk about the different disciplines and almost draw parallels to medical training. Number two, we'll start with the first model, if you will, and that'll be sort of thinking about a business analysis of any given service line. And then I want to sort of take a deeper dive into the various disciplines and talk about different models that appeal to me that I've started applying at a routine basis as to think about how we manage a given clinical program. And I'll keep referring back to liver transplant as an example. And so we'll talk about strategy, we'll talk about operations, marketing, briefly touch on accounting and finance. So that'll be sort of a deeper dive. And then a brief word on sort of leadership concepts. This is something that we spoke about at some frequency throughout the MBA, so the 2-year experience. So we'll touch on briefly on that as well. And then if we have time in the end, I want to just briefly touch on structured problem solving. Actually, this is something that, especially towards the end of the MBA, was a very useful construct that all consulting companies use. For example, McKinsey, Deloitte use the structured problem solving process, and I saw a great application of that concept to medical decision making and administration. So if we have time, we'll touch on that. But before I get into that, let me just briefly share with you my path towards the MBA. And this may appeal to anyone in the audience who's looking to sort of delve into formal physician executive training or healthcare management training. And eventually they want to think about an MBA. So let me just briefly share that story with you. So I was an undergraduate in economics, and so early I started thinking about how do you optimize company efficiency and productivity. And then as I was going through medical training, through residency and fellowship, there was this constant urge to go back and loop those concepts from my economics days back into healthcare. And so luckily, especially when I came to Emory, I had opportunities both within the institution and outside the institution to start getting a feel for formal executive training. And the one thing that I want to draw your attention to is the ProLead course. It had a different name many years ago, but it is now called the ProLead course. And for those of you interested, that may be a good starting point to get an initial glimpse into the different disciplines within sort of a formal MBA. But as I went through all these different training courses, I kept feeling the urge to take my learning at to a deeper level. And so that finally, after approval from my wife, which I think is an important sort of point to make, it's a time commitment. And so when she signed off, I was able to then undergo this formal training at Goizueta, which I feel very fortunate to have undergone. It's changed the way I think about a lot of things, and I'll sort of share that with you along the way. So just a brief recap on my personal journey, and if anyone is interested, I'd love to chat with them if they decide to embark on an MBA in the future. So let me just give you a brief glimpse of the MBA curriculum. It was a 2-year course. Now it's at Goizueta has gone down to, I think, to 18 months. But we started with strategy, and again, these are all semester-long courses. Then we went into operations, and operations was one of the courses that really brought everything together for me. We spent time on data analytics. Interestingly, some parallels to how we look at biomedical data and research, but very similar hypothesis testing as applied to sort of the business scenario. Spent a whole semester in marketing, and I had a new appreciation for the science of marketing. So I'll share with you a few models there. And then we spent time on finance and accounting. And this by far was definitely one of the more challenging sort of phases of the MBA. But after coming out on the other side, I really feel fortunate to have developed the financial intelligence to some degree to at least ask the right questions. And then finally, leadership, as I'd mentioned, was another discipline that we spent a decent amount of time on. So that's sort of a snapshot of the big courses, big ticket items within the MBA. But as I reflected on this, on the course of the MBA, just to think about drawing parallels to medical education and practice, and a couple of points there. Well, number one is the different subjects, especially towards the end of the MBA, we had to do a capstone project, if you will, where we had one of the high-profile advertising companies in the US give us a real project to execute. And so it was a team approach to that. But what was cool about that was we had to bring the knowledge from all these different disciplines to collectively address a specific business problem. And so as I think about this reminds me of medical education. We went through physiology, anatomy, biochemistry, and so we went through that. But then the latter half of the medical school, and then residency in particular, is to bring all that knowledge together in order to answer a clinical problem. So that was sort of an interesting parallel that I noticed. And the second thing that was really a learning point in the MBA, and as I mentioned, there's a lot of teamwork and a team approach to problem solving and learning. And the power of that was illustrated in the MBA experience, but that again reflected what we do day in and day out in healthcare. It's about putting our heads together as a multidisciplinary unit with our nursing colleagues, with our APP colleagues, and then solve clinical problems and learn together. And so that was the other sort of parallel that I noticed as I went through the MBA experience. So now let me sort of go into what I'm defining as a central tenet across all MBA courses. And this is one of those aha moments in my MBA experience. And this is the term that I like, the phrase I like to define: value as defined by the customer. And I'll keep coming back to this again and again during the course of the talk. It is what I realized, and this really applies to healthcare delivery, is we have to understand the customer value. And that's where it all starts as far as defining your right strategy and defining your right operations. And the customer may change depending on the specific context where you're at. So just let me give you examples. And again, I'll keep applying these concepts to liver transplant, but I again invite you to think about how this applies to your own context. So when I think about external customers, again, in the context of liver transplant, I'm thinking about our referring MDs who send their cirrhotic patients to us for transplant evaluation. I'm thinking more importantly, important external customer is the patient. How can you define customer value as defined by the patient? And then finally, another important external customer, if you will, is our peers, the insurance companies and Medicare and CMS. So that's an example of an external customer that we have to make sure we understand value as defined by them. Switching sort of the customer profile, if you start looking internally, you can start defining internal customers. So related services, for example, for liver transplant, interventional radiology is key, and they're key for your service lines as well. So that is a perfect example of an internal customer where you have to understand how do they define customer value and how do they look at shared value as they interface with your specific service line. And another important internal customer is our administrators, our healthcare administrators, who are important partners in achieving our shared goals. So again, another example of an important internal customer that you have to be aware of. And then finally, as I'd mentioned to you, the MBA experience has sort of changed the way I think about even my personal life. And so I extend this argument or this concept to my wife, my kids, my in-laws. So how do they define customer value as I'm interacting with them and as I'm negotiating with my teenage kids? So this is, I think, an important concept that resonated with me as to really understand what customer value is. So expanding on that concept, and that's why I think customer value becomes so important, is the importance of aligning your subsequent strategy and your operations with understanding customer value. So once you sit back and think about what the customer value is and truly define and understand it, then you can then define a successful business strategy, because that has to align with what the customer value is. And we'll flush this out a bit more. And then once you define your strategy, then you can define the subsequent operations, i.e., what resources and capabilities do you need to execute that strategy that is then compatible with the customer value. So I think this is an important hierarchy that needs to be defined and re-emphasizes the importance of making sure that you've nailed the customer value concept very accurately. The other thing that was important to learn in the MBA, and this has become front and center in the COVID era, is the importance of making sure what we call environmental scanning. Make sure you have your antennae up as far as what is changing in the external environment that can then change how the customer defines value. And so, for example, a classic example, I think, front and center is because of COVID and because of lack of access, physical access to patients, how we've switched to telemedicine. And I think that is a great example in the medical domain of how healthcare systems, including ours, have had the need to change their strategy and therefore their operations because customer value has changed. And so I think that's another important point that I want to share with you is please keep scanning your external environment. And the rate in healthcare may be less than in the tech world or in IT worlds where technology changes so much faster. But I think it still applies to our domain as well. All right, so let me now sort of dive into the first model, and this is called the 5C model. And this is a useful sort of a construct as we were initially introduced to it. So what are the 5Cs? Number one is, and this is as you're analyzing a business service line. So number one is context. We already briefly touched on environmental scanning. What is the context that you're dealing with? And again, I'll keep applying this to liver transplant as an example. So the one thing in liver transplant is that we are having a change in organ allocation. More organs are leaving Georgia up the eastern seaboard. So our supply of organs is decreasing. And so what is happening is that is making our patients wait longer and longer with higher disease severity as defined by our MELD score at the time of transplant. So we have to think about that is I think, good example for us as to how the context is changing in our service line. The second C is the company, i.e. your own capabilities. What are your core competencies that define your company? And so within our context, I think about our liver transplant program. It is well positioned given our dedicated transplant anesthesia, our dedicated transplant ICU to accommodate higher disease severity, which is be compatible with the changing context. So that's an example of sort of company analysis. The third C in this model is competitors. Who are your competitors in the market? And so, example for liver transplant would be Piedmont is a great program. We got Mayo Jacksonville, we have Ochsner, and all these competitors are having same access to the potential organ donors in our region. So that's an example of competitor analysis. The fourth C in this model is the customers, and this goes back to sort of the importance of defining customer value. And we define patients as our customers, and importantly for us, referring MDs are our very valuable customers. And the nature of this customer, the referring MDs, is what we have. They have low switching costs, i.e. they can easily switch gears and start referring to Piedmont. So we have to understand customer value as defined by that referring MD. And another example is how do we identify new or blue sort of new space. And so one thing we've done with some success is to start getting out-of-state referrals. Given our core competencies and our competitive advantage, we now have referrals from all our neighboring states because we can take care of higher disease acuity. And a recent example for us was the Kaiser contract, the dedicated Kaiser contract for liver transplant, similar to the BMT contract for you. That was an example of identifying new customers that we can gain access to. And then finally, the fifth C in this model is collaborators. Who are your partners? And again, it sort of goes back to referring MDs and pairs. And as is in your situation as well, pairs are watching our transplant outcomes very carefully. So how do these collaborators, how do we define value for them? Another example of the collaborators would be internal collaborators, i.e., for example, interventional radiology would fall in that category. So just an example of a model that defined as the 5C model, which is a useful sort of checklist of a quick analysis of your service line at a given point in time, and to define future strategy. All right, now let me switch gears and sort of get into more, sort of delve deeper. Again, these are all one semester courses, but I'll give you sort of the snapshot of some of these concepts. So let me start with strategy. And again, let me start with the definition. This is a very simple definition, which says a plan of action or policy designed to achieve a specific objective. Very generic. But let me give you a second definition which really resonated with me, especially as I think about what we do in the hospital with regard to liver transplant. I'm sure it applies to you as well. And this definition says that a strategy is a design of interconnected activities and capabilities. And so as you think about this, I think about I have to interface with I have to have the ICU service right. I need to have radiology right. I need to have interventional radiology and pathology right. So I think that's an important concept, interconnected activities and capabilities that create unique customer value. So something that generates competitive advantage for you that your competition cannot do. And the third part of this is to achieve sustained competitive advantage. Keep thinking about how you can redefine your competitive advantage so it stays sustained. So this definition of a strategy really appealed to me because it really encompasses what we do day in and day out in a tertiary care center, especially as we offer complex services such as you do in the cancer center. And so I think it's an important sort of take-home definition for strategy. The second comment here, and I lose some sleep over this at some frequency, is that in that strength of interconnected activities and capabilities lies its weakness. And so example is, if tomorrow I wake up and something has happened in interventional radiology with regard to faculty or resources, or if we have a slight perturbation in our liver transplant surgery group, that can then rapidly lead to a breakdown of this competitive advantage. So just to sort of share that with you as well, we're creating a complex system to create a competitive advantage, but therein lies the need for constant surveillance to make sure that all the pieces of the puzzle are humming, if you will. All right, so now let me get into tools, and we'll keep talking about different tools in different disciplines, but this is something that I'm sure a lot of you are familiar with in strategy SWOT analysis. But just to recap on this, the SWOT analysis is an internal sort of analysis of your strengths and weaknesses, and this needs to be an honest appraisal, if you will, of your strengths and weaknesses. And then opportunities and threats is the external analysis, if you will. And so it's sort of it's a very useful, quick look at the current state and potential future state. And so, just to apply this to my liver transplant domain, strengths would be experienced faculty across the board, dedicated liver ICU. Those will be examples of our strengths. Weaknesses, and this is something that we get feedback from, is suboptimal communication with those important referring MDs, who define customer value as good communication. And the second thing, and you may be facing this to some degree, is barriers to optimal access, patient access, outpatient, inpatient access. And so these will be examples of potential weaknesses compared to the competition. And then opportunities, an example would be new market share in neighboring states, new contracts, new dedicated contracts, for example, with Kaiser. And then threats. I've already spoken about in my domain of decreased organ supply, but COVID was a perfect example of external threat that came out of left field, and we had to sort of deal with it. So I think a lot of you are familiar with this model, but I think it's very useful just to recap on the SWOT model. Let me move on to another important model that we spoke about, and this is called the Porter's 5 Forces. He's one of the gurus in the strategy world, but I think it makes a very useful construct. So what this model says is the following. You have, number one, industry rivalry, which is sort of in a given market. You will have, you have Emory, you have Northside, for example, you have other sort of healthcare systems. So that is industry rivalry within the cancer domain. The second sort of a force, if you will, is the suppliers, the bargaining power of suppliers. And so that, and we'll go more, I'll apply this more into liver transplant, but that's the supply chain, if you will, that is supplying patients for us into our system. The third force is the bargaining power of buyers. Who is buying your product? And so that, a perfect example would be the insurance company. The fourth force is threat of entry. Is your market ripe enough or attractive enough that somebody else is going to step into that market to grab market share? And so that's the fourth force. And finally, the fifth force is threat of substitutes. Is there something that can create a technological advancement that can then take over what you're offering as far as your product, and therefore your market share for your product goes down? So a useful construct that really summarizes a given industry and the nature of that industry. I think it really has applications to different disciplines within healthcare. So let me just apply this to liver transplant, just as an example. So industry rivalry, we don't have to look far. Piedmont is a fierce competitor. Threat of entry, luckily it's low. we have been fortunate in Atlanta that we only have 2 liver transplant centers, as opposed to Chicago or Boston, where we're dealing with 6 transplant centers that are fighting with each other, if you will, and increase the industry rivalry. An example of supplier power would be referring MDs, and so you can define whether it's low or high, and I would define this supplier power as high because they can easily switch their practice and refer to the competitor. Biopower is, and a great example is insurance payers, CMS, and private payers who are constantly watching our outcomes, and they can easily sort of flag us and stop the contracts if our, for example, our 1-year survival, which is our big metric, falls below a certain threshold. And then threat of substitutes, luckily for liver transplant, is currently low. One of my interests is extracorporeal liver support, but I think we are far away, at least in my lifetime, to replace liver transplant with regard to therapy. So that's, I think, a good example of analyzing the threat of substitutes. So I just want to share this model with you because I think it as you think about your service line, I think it'll apply really well. So now let me sort of take another step back. And we've sort of talked about strategy, but as I think all of you can identify with, there is a long road between strategy and execution. You can sit in your boardrooms, you can sit in your conference rooms and define strategy all day long. But what does it take to take that strategy and then take it to the front lines and execute that strategy effectively and in a sustainable fashion? And I'm sure all of you can identify with this problem or the challenges involved in doing this. And there are millions of books written on this. We spend a fair amount of time talking about this. And I still have challenges every day as you walk in to sort of try to facilitate this conversion. But just a few models to share with you, and this will be the only reference I think I'll put up on the slide deck, is a book that is defined as execution, and that those are the authors, but I think it was a good read. And what it talks about is sort of the 3 rights. Right strategy, which means make sure it is compatible with customer value. Right processes, make sure you have the right internal processes and capabilities that align with the strategy. And then this is something that I've come to appreciate even more and more along the way, is having the right people in the right positions to help execute it. Make sure you choose your people wisely as you go on this journey from converting strategy to execution. So just wanted to share that reference with you in case you have the downtime to read a book. The second construct that we were introduced to is, and you may be familiar with this, is the 4 W's and the 1 H. And the 4 W's is what you want to do, why do you want to do it? And I put why in yellow because I think that is important. And some of you may be familiar with Simon Sinek, who talks about creating purpose in an organization. So when you are sitting at a higher level and defining strategy, I think it is very important to make sure that your front line knows why you're trying to achieve that strategy and to improve customer value. And I think that really creates a shared purpose when you make sure you address the why in this model. And the other items are who's going to do it, when, so create a sort of a time-limited or time-sensitive execution strategy, and then the devil's in the details. How do you do it? But I think it's a useful sort of checklist of going through this sort of model as to how you want to convert strategy to execution. And then finally, I guess one other reference, and this is more of a recent read for me, is the 4 disciplines of execution. And this book talks about, number 1, prioritizing your goals. You got a lot of ideas, but make sure you almost use a Pareto principle, sort of the 80-20 rule. Make sure what is important and prioritize that first in order to order the execution by priority. It talks about, I think, an interesting concept, which we're applying in liver transplant, is focus on lead indicators and not lag indicators. So let me give you an example. One of the things we are measured by is number of liver transplants, because that automatically translates to increased revenue, increased profit. But rather than focusing on that, it is important to look at and so that's an example of a lag indicator, number of transplants. Lead indicator, an example would be number of referrals, for example. that would be some percentage of which will be converted to transplantation. So that is something we're focusing on. That's a good example of a lead indicator in our domain that we keep a constant eye on. And then the other thing that the book talks about is maintaining a compelling scorecard that everybody can see. And that's not to sort of compete one person against the other, but just to create a shared passion for what you're trying to achieve. And sort of a real-time feedback at some frequency of where we are in the journey from strategy to execution. And the fourth thing that is always challenging, I think, especially in a hierarchical academic system, is, and this book talks about it, I think with some eloquence, is the cadence of accountability. There needs to be a mutual accountability amongst the group of making sure that everybody shares that shared passion of converting strategy to execution, including the leadership. I think there needs to be leadership accountability, if you will. So just wanted to sort of share some of the bullet points from this book as well that you may find interesting. And the last point on this slide, and I haven't put it up there, is I think this is one of those domains where I think the right leadership is so important. And not just leadership at the top, it's about, I think, all of us as our leaders to some degree, irrespective of where we are in this perceived hierarchy of healthcare. And so I think that the importance, and I've come to appreciate it more and more, is the importance of the right, identifying the right folks to lead the initiatives for successful execution across the whole hierarchy. The last concept I want to share with you in the strategy domain, and this was another sort of a concept that appealed to me, is how to link the strategy with a balanced scorecard. I think all of you are familiar with a balanced scorecard, but just to review that, when you're defining, sort of looking at vision and strategy, the balanced scorecard has sort of the financial domain and how are you doing on your income statement. The second part of this is customer relationships, or customer satisfaction. What is value as defined by the customer? The third in this balanced scorecard is internal processes. Do you have your internal processes, whether it's Lean, whether it's Six Sigma, have you optimized your internal processes to achieve customer satisfaction? And the fourth domain that I've come to appreciate more and more, and I harp on this in our meetings, is make sure you take care of your people within your institution, within your team. Make sure they are growing, they are achieving the skill set and the skill expansion that they are yearning for, because that really leads to employee satisfaction. So that's sort of the balanced scorecard. But then this concept got hooked into a strategy map. And I think it's a useful concept, at least for me, it resonated with me. And what this says, and this chart is from a sort of manufacturing company, but what it says is don't focus right away on the financial sort of metrics, which we may tend to do, but start thinking about a sort of a domino effect, where if you invest in your team, in your colleagues who are in the front lines and at various rungs, and you couple that with good internal processes, you will then develop you'll optimize customer value, and you'll achieve value as defined by the customer, and that will automatically then lead to increased market share, and then your profit margins will grow. And there are many books written on this, but I think the important take-home message here, at least for me, was to really focus on customer satisfaction, customer quality, internal processes, employee engagement, and employee growth, and then the dollars will follow, if you will. So this is I just want to share this with you because I think it was a useful construct to connect the balanced scorecard with defining strategy. All right, let me switch gears and let me sort of go to operations. Operations is sort of, again, a generic term, a set of processes to convert a set of inputs into output of customer value. Sort of generic sort of definition, but again, sort of breaking this down a bit more. And again, this is a one semester course, but I'm just going to give you the highlight, if you will, or the high level view. So inputs would be, as you can imagine, patients, equipment, labor, capital, right? So those are typical resources then sort of that go into inputs. You have your transforming process, which is your operations, which is sort of specific to any service line. And then you want to create an output that is of adequate quality, if you will. And so, we'll talk about in the liver transplant context. I want to make sure that we have patients that have good short-term and long-term outcomes. And so that is the optimal output, if you will. And this will, I'm sure it resonates with you as well. I'm stating the obvious here. But that's sort of an important concept. And there's a deeper dive that we did into each of these concepts. And we spoke about supply chain within inputs. We spoke about within operations, how do you really achieve high quality? We spoke about lean, we spoke about Six Sigma, and then we spoke about optimizing output as well. But the other thing that I want to share with you at a high level is the importance of what we spoke about, feedback loops. Always keep looking and analyzing your output, for example, and seeing if you need to re-engineer your operations in order to achieve the optimal output. So that was one feedback loop that we spoke about. The second feedback loop is once you look at your operations, make sure the inputs are not changing. And how do you need to adjust the operations in order to, if your inputs are changing as well, and vice versa. And I think this is a good example of the COVID phenomenon where we had to adjust operations based on how the inputs changed. So just to sort of think, just to give you a construct about these feedback loops between the different parts of this algorithm, if you will. So tools and operations, just to sort of touch base on this, I think a lot of you are familiar with this, but process mapping was something we did a fair amount of the course. And again, in the context of healthcare, I think one concept we spoke about in business school was defining the customer journey map. Look at the process as viewed by the customer. And so this appealed to me when I was sitting back and thinking about it. This is, and some of you may already be doing this, is how do you define the patient journey map? And this may not be compatible with what we offer in some of our services, and especially in traditional academic silos within a large tertiary academic center. And I'll give you an example of this as I go along with regard to our liver intensive care unit. So when I apply this to liver transplant, as you can follow along, an example of a process map as we map it out and see where we can improve is you got a patient with cirrhosis who needs a transplant. The referral comes in or a transfer request comes in from outside hospital. And then we got to make sure we get them in. And this could be outpatient or inpatient. And then we stabilize them, we work them up for transplant, get them to the operating room for transplant, and then post-transplant care. So that's a sort of the obvious process map for my domain. And we look at this process map at some frequency every month and see how we can optimize each of these sort of stations and the arrows that connect these stations. Yeah. And so just want to share with you, as you think about this customer journey map, what we have done as far as liver inpatient care, and specifically the liver, some of you may know we have a dedicated liver ICU. And as I reflect on that journey, I think it gives you, at least for me, it gives me a good example of how we may have optimized the patient journey. So let me just sort of slip into that. So here's an example of what I'm defining as a traditional patient journey map for a patient with cirrhosis. And so let me just sort of share this with you. And this is what I experienced in my previous institution, for example, and this is still the paradigm in a fair number of liver transplant centers. And so imagine you got a patient who comes through the ED with cirrhosis, who comes with variceal bleeding, comes with hepatorenal syndrome, and then finds their way into some non-specific pre-transplant liver unit. And this could be hospital medicine, this could be anywhere in the hospital, and then they get sick. They start developing hypotension, and they're scrambling for the first ICU bed. And this could be a medical ICU bed. Oh, well, there are no beds here, and this may become important even in our COVID era. Oh, let's find the next non-surgical bed, and that takes us to a cardiac intensive care unit. So as you can already see, you have a lack of specificity with regard to taking care of a potentially very complex patient, where the capabilities and resources may not be aligned to optimize the patient care. If somehow the patient stabilizes here and gets a liver offer, they go to the liver transplant for the operating room, but when they come out, they go to a totally new intensive care unit, the surgical intensive care unit, where these folks have not even seen this patient before and are not aware of all the issues that could be happening pre-transplant. And then once they leave, they go to another non-specific post-transplant unit. So as you can see, this journey map may not be compatible with optimizing patient care because you have so many handoffs and you're dealing with somebody with multi-organ system issues, not just hepatic issues. And so let me contrast that with what we have created at Emory. And again, I share this with you as an example of potentially improving the patient's journey. So here, when the patient comes in through the ED, they go to a dedicated liver inpatient unit, which is 6T right now, which has specialized APPs, specialized faculty, specialized nurses that understand the complexity of the sick liver patient. If they decompensate, they go to a dedicated liver ICU, where the nursing staff, the APPs, the faculty are very facile with dealing with both pre-transplant and post-transplant ICUs. And I put a bidirectional arrow because there's persistent crosstalk between these two units. And then finally, they go to the operating room, they get the liver transplant, and this is a patient intubated, on pressors, on CRT. But after transplant, they come right back to the same bed that they were pre-transplant, where the nursing staff, the APPs know exactly what went into the OR. And so they are the perfect sort of care provider team to take care of the patient when they're coming out of the ICU. So here's, I think, an example of where process mapping has really helped us optimize the patient journey, if you will. And this has led to, importantly, to some of the best post-transplant outcomes we've had in the history of the program, despite our patients getting sicker and sicker. And so this is, I think, a good example of disease-specific approach to care delivery. And this, I think, would apply very well to some of your cancer service lines, especially your complex cancer service lines that need a lot of TLC. And as I mentioned, this has translated to highly favorable patient outcomes. And interestingly, there's been, I think it has led to sort of employee growth or colleagues' growth. The sharing of knowledge between the ICU and the floor team. So APPs, there's chronic crosstalk. The fellows, there's a lot of crosstalk. And our nursing caliber has really grown. And every time I step out of our institution and compare notes with others, large transplant centers that want to mimic this model, I realize what we have. Because one of the things that I really feel fortunate to have is our nursing colleagues in the ICU are very comfortable taking care of that bleeding cirrhotic and also with postoperative drains. And that growth in their skill sets is hard to sort of to mimic or to replicate in some of these outside centers where they're still in their silos between the MICU and the SICU. And just to sort of mention that, I think an important construct here is the importance of having organizational support. And as I reflect back on this journey, I think I was fortunate to have the Emory Transplant Center and the Emory Center for Critical Care really have their blessings and their support to help us execute this strategy of really thinking through the customer journey and then mapping out a whole new process and executing the process that is now sort of on autopilot, if you will. And this is, I think, it speaks to the removal of department silos. So I'm looking at the clock here. It's 8:20. I just want to make sure that I have enough time for questions and comments. I think we finished at 8:30. So let me summarize some of these slides. I might just briefly hit on this. I think you're all familiar with lean management, Six Sigma, and this is sort of other models that we spoke about, but I won't belabor this slide. But I think this is something that Emory has really invested in, and I'm sure you're doing your sort of lean journeys, but I think that is something we apply in our transplant center as well. Let me briefly talk about marketing. I think this is an interesting concept, where the role of the marketeer, which is a new noun that I discovered, is to create, communicate, and deliver value to the customer. And this was an important model, another C model, but it's the 3C model. And I think it's brief yet elegant, where you draw three, sort of almost like a Venn diagram, where one is the company, that's you. The second C is the customer, and the third C is your competitor. And what you're trying to do, and here is your competitive advantage, where the company, you interface with the customer, but the competition cannot touch that space. And the goal is to maximize that part of the Venn diagram where you maximize your competitive advantage and minimize the part of the Venn diagram that intersects with the competition and the customer that you don't have access to. So this is a useful construct where we went through different models in the MBA course and looked at different industries and also reflected on our own industries, where you can do a simple competitor analysis and see how you can optimize your competitive advantage and minimize your competitive disadvantage, if you will. So I just wanted to share that sort of simple 3C model with you. The last model I want to share in marketing is, I think, another useful construct that resonated with me, and it's called the STP model, where you and the STP stands for segmentation, targeting, and positioning. So let me walk you through this. The segmentation is you look at the whole potential market and then look at specific segments that may be appealing to your value proposition, where you can identify customers. And once you define that segment, then you start targeting that segment. You can't be offering your product to everybody, but then target that customer and that customer section, and then using branding or using other strategies, position your product into that specific segment. So let me give you an example of this and how we applied this to liver transplant. And we've actually created a dedicated sort of outreach and marketing group within our liver transplant program. So when I looked at our potential customers, and this is an example of segmentation, I'll ask myself, who refers to us? It could be primary care, it could be GI, it could be, as our patients are getting sicker, it's not the traditional GI referrals. There's hospital medicine, there's ICU, there's emergency medicine. And so as I look at all these segments, I sort of struck out PCP because that typically goes through a GI referral. So I said, let's make sure that in addition to GI, we make sure we target these new segments that are actually interfacing with our potential customers, i.e. the cirrhotics. And then once you define these segments, then you zoom in on that subset of your potential targets. And once you target this, then you start thinking about how these different subsegments define value. And so just to give you an example of that, and that goes into positioning, and this sort of specifically goes to access. The GI doc may all be looking for outpatient referrals. So I got to make sure our outpatient referral strategy is optimized. However, the hospital medicine and ICU and emergency medicine folks are dealing with inpatients. And so how then that becomes a focus on looking at inpatient strategies, make sure we talk to our transfer service and do the right marketing to make sure that everybody's aware that we have a dedicated liver ICU. So I just want to give you that flavor of how we applied this to our program and the importance of how you can utilize the STP model to, number one, define the segments that you should target. Number two, how do you position, once you define those segments, how do you position yourself as you define their unique customer value? All right, I'm going to skip accounting and finance for the sake of time. I'm going to summarize this slide, and I'll be glad to go into Q&A. But what I want to sort of share with you is, I think, and a lot of you in the audience may already be aware of this, is just make sure to identify your contribution margin to the system. Because if you're a profitable system, then, and you have awareness, you have financial intelligence of what you bring to the table, that makes it a more useful conversation when you are going to the healthcare administration in order to ask for additional resources and capabilities. So just to sort of step back a little bit, and broadly speaking, if anyone is interested in sort of physician executive or healthcare executive training, I think an importance of financial intelligence in order to have that more richer conversation, in order to for decision making and for communicating with healthcare administrators. The last point I want to make here, and this sort of goes into this concept, is that especially as we go from fee for service to pay for performance, I think you're all aware that the price, on the price side, the numbers are going down. And so we really need to figure out, as we do process improvement, how do we decrease cost? How does that transfer to decrease cost? Because I think that is going to be key in order to really understand how you can increase your profit margin. And again, in the Q&A, and if we have time, I'll definitely sort of dive deeper into this. The last point I want to talk about is leadership, and just a sort of few parting thoughts here, and then we'll go into Q&A. You know, we spent a fair amount of time on leadership, but here, you know, we identified adjectives, and, you know, authentic, integrity, inspirational, visionary. And it was very interesting throughout the MBA, we came across multiple examples of companies that had a great value proposition, great product, but because of poor leadership, that company failed. And so I think and as I sort of reflected on those instances, it just made me aware of how important leadership is for any sort of company, including a healthcare system. And then something that resonated with me, and even before the MBA, and this is an interview with I think he's the ex-dean of the Harvard, or maybe the current dean of the Harvard Business School, who speaks a lot about leadership. And he was asked, how do you define leadership? And the answer really appealed to me, and this, I'm paraphrasing him, but he said a leader is judged by the people that he or she leads. And if they report being better off under that leadership, then that is good leadership. And that really resonated with me, and sort of goes with the concept of service of a servant leader, is for any leader, and I'm sure there are a lot of leaders on the call, is to really do a pulse check with the folks that you're leading at some consistent basis, and make sure that you're in tune with, again, value as defined by them. Because I think that is so important, and it is, I think, simple yet profound, and really resonated with me. So I just want to share that with you. And the other thing that I sort of learned in the MBA, and we had a class of 40, and I learned as much from them as from the professors, and these are very talented individuals, and what we see in healthcare as well. And this has really made me be a better listener as we did teamwork. But the other thing that it made me do is really, as I'm sitting in a group, to really sit back and make a conscious effort to identify the strengths of each individual in that team, so that we can harness those skills to execute our sort of overall collective goal. And then, as I've mentioned, I've definitely become a better listener, where you can sit back and just listen once you acknowledge that you got a lot of smart people in the room. And then the third thing that I think we at Emory Healthcare have gotten doing a very good job of over the years, is the concept of psychological safety. You know, I personally hate hierarchies, but I think it's so important that you're sitting in a group to eliminate the psychological hierarchies and create a concept of psychological safety, where everybody can sort of share their thoughts and their input as you're trying to engage in collective decision making. All right, I'm going to skip this for the sake of time, and this is something that we can talk about later, but just a summary of takeaways, and I hope we have time for questions and comments. I harped on understanding customer value, which I think is a starting point for everything, and recognizing that it's the main driver for a successful business model. Once you define customer value, then you define your strategy that aligns with customer value. And then finally, you can then define the necessary capabilities and resources, i.e. operations, to achieve that defined strategy. The other thing that, just to recap, is marketing your unique competitive advantage and communicating that successfully to the outside world. We didn't get much time to talk about this, but I would encourage, for those of you interested in this, to develop the basic financial intelligence and there are many mini courses that various that are offered, especially outside the institution, that can really give you additional insight as you in decision making. And then again, we didn't get time to talk about this, but just if you're interested, think about a structured problem solving process. All right, I'll stop right there, and I look forward to your comments and your questions.
Ram, thank you so much for that interesting lecture and challenging us to think in different ways than we are used to. Before we take questions, I just want to let the audience know that they can use the Q&A feature or the chat feature in the screen to type in questions. While we wait on questions, I also want to make sure that we will be here again next Wednesday for the next grand rounds, and this will be by Dr. Quinn Lee from Stanford, who will be presenting on overview of NRG oncology and trials in head and neck cancer. If you want to view all upcoming Winship Grand Round lectures and also archived Grand Round lectures from the past, you can visit the Grand Rounds page of the Winship Cancer website or the Winship calendar. So Ram, I have one question. You talked about customer value, and customer for us is not just one entity, right? There are different constituencies even among customers, and there are regional variations in healthcare. Particularly, not all customers come in with same expectations. So while we think that providing great care is what customers come for, it may not necessarily be true. So how do you sort of think through that as you think about customer value?
So thank you for that question. I think it is, it is challenging, especially as the customer changes. But I think it's about, at least as I think through our system, it's about sitting down and reflecting on identifying those different phenotypes of customers. I think that's the first potential gap analysis that is important. And once you identify those different phenotypes, then I think then it's about having a conversation with them as to what they value as their customer value, and then sort of aligning yourselves. Again, there's only so much you can align with sort of differing customer values, but then it's about priorities. It's about the pie chart, if you will. It's almost, I think about the Pareto principle as the 80-20 rule. Where is the majority of your service line dependent on? Which customer? And then maybe that's a way to prioritize or frame your strategy and operations.
Great, thank you. We have a question from Dr. Ned Waller, and it's a provocative question. What's the low-hanging opportunity for Emory Healthcare to improve value delivery?
That's a great question. So again, I'll go back to my home base. One thing that, again, this is compared to our competition, two things, actually two low-hanging fruit, if you will, for us, is improved communication with referring physicians. That's something that we hear about all the time, whether it's, and hopefully our Emory systems will help us do that better. So that would be, I think, in my domain, one low-hanging, so definitely sort of one low-hanging fruit. And the second is access. Is that the patient who gets referred is getting an appointment in 3 months or 4 months, where they need to be seen as defined by the referring doc tomorrow. So I think those would be two ideas of low-hanging fruit, where access and communication.
That aligns very well with some of the issues we've been thinking about as areas for us to work on as well, Ram. Last question we'll take from Dr. Ashish Patel. He wants to know, what are your thoughts on Emory's org structure in regards to its ability to be nimble to challenges? Are we too matrixed? How do we promote lean processes in that sort of an environment?
So that's a great question. I'll try to be politically correct, if you will. But I think there is an opportunity to decrease the hierarchy, and an opportunity to improve what I would define as bidirectional communication. And so sometimes I feel that once we define strategies at our level, at our business unit level or clinical unit level, there's a long lag time between that strategy getting defined, finding its way up the chain to the eventual decision makers, and then coming back to our level. And that's time. And especially in a competitive market where you have a competition that's very nimble, relatively speaking, that could really hurt market share. So I think more agile decision making, more access to the higher ups, if you will, that can then work with you to execute your plan. And the other point I would make is to have sessions where you're collectively making decisions, where your business unit strategy is compatible and aligned with the organizational system strategy. Because I think there's an opportunity there to have a better conversation and a bidirectional conversation. So that would be my response to that question.
Well, Ram, thank you so much. We would love to have you back to ask you for some more questions and thoughts on key issues that you touched on today. But I really want to take the opportunity to thank you and thank all of you for joining today. Hope you all have a wonderful day, and we'll see you next week.
Thank you again for having me. Appreciate it.